Hello, and welcome to the Sound Relief Podcast, where we offer expert advice and practical solutions for anyone with tinnitus or other auditory issues to provide hope and help. Today, we'll cover the basics of tinnitus. First off, tinnitus is not a disease or disorder. It's typically a symptom of change somewhere in the body. And I do know from experience that the more we understand about tinnitus, the less scary it will be. Let me try to help. The pronunciation of tinnitus is something we get asked about all the time. Is it tinnitus or tinnitus? Really, either are accepted. Kind of like potato, potato, tomato, tomato. I prefer tinnitus. That's what we'll stick with in this podcast. A common description of it is, like I said, ringing, buzzing, hissing. We've heard people call it crickets, cicadas in their head, the sound of electrical wires buzzing in the background, TV noise like the fuzz of old television sets between channels. We've heard people describe it as air leaking out of a tire, or just a pure tone, a high frequency pitch, really high, like a piccolo or flute, for instance. It's hard to duplicate brain generated activity that is the sound of tinnitus, but we often ask people to try to describe it so that we can better relate and understand what it might be like to hear that sound, either intermittently or constantly. Another description is pulsing to our heartbeat. So that would be pulsatile tinnitus. And that can be extremely disturbing because you're constantly hearing that pulse um, in rhythm with your heartbeat. Not as common, fortunately, as the other types of tinnitus, but we'll get to that in a future episode as well. When we talk about tinnitus frequency, we mean, is it intermittent and coming and going, or is it constant and 24/7? So, intermittent tinnitus that comes and goes is more we know of a warning sign, a warning signal. Much like you've probably experienced if you've ever been to a concert and left the concert or show and thought, oh my goodness, what is the sound I'm still hearing in my ears or my head? That's tinnitus. For most people, the next morning you wake up, the tinnitus is gone, and you think, great, that must not have done any long-term damage because it went away. But we do know repeat exposure to loud sounds over time will eventually catch up to us. And so constant tinnitus, we think really is when we get to that point where some damage has occurred or change has occurred. So the interesting part is I have tinnitus, for instance, in my left ear. And if I have an audiogram or a hearing test done with my hearing, my left and right ear seem about the same on an audiogram. But when we look at otoacoustic emissions, which is a much more sensitive evaluation of the inner ear and the hair cells in the inner ear, my left ear has weaker otoacoustic emissions than my right ear. So it makes sense that my left ear, especially in the highest frequency range, about 7,200 hertz is the pitch of my tinnitus. And that is exactly where my otoacoustic emissions show a decrease in the response. So, for sure, I think, when I didn't know any better and I went to concerts in my 20s without hearing protection, without earplugs or custom filtered earplugs that I wear today, I did some damage. And today I can control my tinnitus. I only hear it about 10% of the time now, typically only with stress or loud noise exposure. But I'm really good about carrying my filtered earplugs today to avoid that exposure. So constant tinnitus is really what we deal the most with, honestly, clinically, because constant tinnitus leads to a more bothersome response. And that's the next type of description we have for tinnitus. Is it bothersome or non-bothersome? Non-bothersome tinnitus, I know is hard for someone with early onset of constant tinnitus to think, how could it ever be non-bothersome? It's so intrusive and invasive and annoying. But there are many people, after many years of being told nothing could be done, they've naturally blocked the perception of tinnitus on their own. We call that habituation. So that's a fortunate way that many people can learn to cope and deal with their tinnitus. It's much like if you bought a new appliance, say a refrigerator or a dishwasher, and the first time it runs a cycle. For instance, with the refrigerator, maybe it's ice, and when it's making ice and the ice drops, and you think, "What is that sound?" Once you label it, once your brain identifies that sound as non-threatening, it's neutral, it's not important, we can tune those sounds out. We can ignore them easily. But if we label a sound as threatening or annoying or invasive, distressing, disturbing, any of those types of negative labels, we are more likely to constantly monitor it. And this is happening even at the subconscious or lower brain level, where you don't mean to be monitoring it, but our nervous system is wired to constantly check in and protect ourselves from potential danger. And so if we have a negative label to tinnitus, we're more likely to check in on it frequently. Is it still there? How loud is it? What does it sound like? Is it changing? Is it constant? And the more we think about it, the louder we perceive it, the louder it can become over time, and it can become a vicious cycle, which we really want to try to help people avoid getting into that vicious cycle of tinnitus. So really the goal for a lot of what we do to help people is to change that label. And it takes both active effort to change that label of tinnitus from threatening and negative to neutral and non-threatening. So it can take time. It can take the need for help from a expert, an audiologist, perhaps, who has experience working with tinnitus patients. And we think of it like a dimmer switch. We're really trying to help dim the tinnitus intensity down, because unfortunately we haven't found an on-off switch in the brain. So there's no easy way to get in there and just turn off tinnitus. We really wish, trust me, that there was an easy way. But unfortunately we haven't found that to date. And so the good news is we are able to help people. I am proof positive that this can happen. My tinnitus was really loud and invasive a few years ago, and it was impacting my ability to focus and concentrate and listen to my patients. But fortunately, with tinnitus retraining therapy and prescriptive sound therapy, I am now one of the fortunate ones where, like I said, I only hear my tinnitus very rarely. I would say maybe 10% of the time today. So I feel very fortunate that I can be in that population of people with non bothersome tinnitus today. And I have the skills and tools in place so that if it does become bothersome, I can get back on track and I can take control over that tinnitus and get relief that I need. Um, the next area I thought we'd cover today is something we get asked every day. That's what causes tinnitus? What are the most common reasons for tinnitus in the first place? Um, the number one cause of tinnitus is noise exposure. So, loud noise causes damage, like I said earlier, to those inner ear hair cells. And when the hair cells start to die off or become missing, the brain oftentimes is searching for that missing input. And when the brain's searching for the missing input, it creates hyperactivity in the auditory neurons in the brain. That hyperactivity is often what we think we're hearing as our tinnitus. And so we need to calm down that hyperactivity for a lot of people, replace the missing input when there is noise induced hearing loss. Typically, what that looks like is normal bass hearing and a high frequency notch. We call it a noise notch, where someone's hearing decreases, typically right around 4 kilohertz. Um, so we see a decrease in hearing and then recovery or slight improvement in the hearing levels a little bit higher in frequency, so around 6, 8, 10,000 hertz. So noise notches look very different than other types of hearing loss, that would be the number one cause that we see. Number two would be stress or a stressful event. Think of a change in health or a major change in lifestyle. And it's just kind of a perfect storm that can happen for people where unfortunately something negative happens, say the loss of a loved one, or many times like an empty nest situation where everyone's moved out of the house and now we're totally making lifestyle changes to accommodate that, or retirement and trying to figure out what am I going to do next with my life. Those are common ones that we see for patients where they had maybe intermittent tinnitus prior to this stressful event, and then all of a sudden they wake up one day and they say, "What is this? What is happening to me? Why am I experiencing this nonstop 24/7?" It starts to impact their sleep, their overall, focus, concentration, ability to enjoy quiet activities like reading, uh, fly fishing, anything that would normally be a kind of quiet, subdued activity. And we think, okay, we got to get this in check because life is stressful, right? It's impossible to avoid all stress. But if people are wondering why, oftentimes it is a stressful event plus a subtle change in the inner ear structure, some change somewhere along the auditory pathway from the ear to the brain that just happened to coincide with this stressful event. Other causes for tinnitus would be related to other disorders like Meniere's disease. Meniere's disease is a combination of hearing loss, tinnitus, and vertigo or chronic spinning sensation, which can be really debilitating. The most debilitating part of Meniere's is honestly the vertigo. Meniere's can also be referred to as endolymphatic hydrops, although typically with endolymphatic hydrops, the vertigo element is not as severe. So tinnitus is definitely associated with these fluid fluctuations in the inner ear that are causing the Meniere's symptoms. Another common cause would be diabetes. And so diabetic patients, even if they have everything, in check and controlled, can still experience progressive hearing loss and tinnitus. And so we're not sure, is it the hearing loss causing the tinnitus or the changes in insulin levels in the inner ear perhaps causing tinnitus? Regardless, we know that there's definitely some association there. And also, another common cause would be hypertension. So, any compromise to, blood flow, we think there's only one artery to the inner ear, the cochlear artery. So, if there's any, untreated hypertension, that could be contributing as well. And so, these are types of things that we need to have looked at, have checked, talk to your primary care physician if you suspect any of these conditions so that you can get that ruled out and see if any treatment there could help reduce the symptoms of tinnitus and the other side effects affiliated with those disorders. And, really, when people think, well, okay, if I understand all these basics about tinnitus, what should my first step be when I'm experiencing constant tinnitus? And really, the one of the first steps that all people should take is have your hearing checked. So many people have not had a, screening since high school, or grade school when we talk to people and ask them, when's the last time you had a hearing check? And honestly, screenings, even at health fairs, are not particularly accurate because they're typically not in a quiet enough area to be exact or precise, and they're typically pass fail type formats. So, really get your hearing checked if you're experiencing constant tinnitus because we want to help you rule things out. We want to make sure you don't have wax impacted. We want to, wax something simple like that. We've seen cases where you clear out the wax and all of a sudden their tinnitus is gone. Is that every day, every case? No, but it can happen. So we want to make sure, have we checked for any blockage in the ear canal? Is there anything behind the eardrum like fluid? Usually you'd have pain associated with that. And so you would know. okay, hey, I need to go to the doctor. I have an earache, right? And get that checked out. But sometimes people have fluid and they don't realize it. Maybe because they had chronic ear infections in childhood. And so they become immune to the pain and the feeling of blockage. So that's something we can rule out very easily, very quickly when we do a comprehensive hearing evaluation and tinnitus evaluation. We also want to make sure there's not a big asymmetry or a big difference between the right and left ears. And that would be, indicative of possibly something else going on that we want to rule out. And so then, we might say, let's refer for some imaging studies and make sure there's nothing abnormal going on, medically speaking. And so really it's wise to get this checked out if you have constant tinnitus so we can make some smart decisions about what care is needed to really understand better what's happened, what's changed, what's new, and make sure we're not missing anything. Especially something simple, because like I said, wax removal can be done typically, in less than 30 minutes, and ear infection, that's typically going to clear up after a round of antibiotics, for instance. And so um, it's always smart to get this checked out. And if it is something, as basic as a noise induced noise notch hearing damage, we can help with that. We can correct that. And so that's why we say first step, get checked out, make sure we're not missing something. Um, Another important thing you can do right away is avoid silence. If you're in a completely quiet room, you're going to sleep in a completely quiet space, what's going to happen? The brain is going to go directly to the tinnitus and be focused on that signal and be hyper focused to a point where it might be really hard to fall asleep or be distracted away from it. But if you have a low level signal in the background, a fan, a humidifier, a noise app, I love the sound of rain. I, to this day, cannot sleep without a sound generator on. Typically, on my phone, I'm playing a relief app with the rain all night long, not just, for 30 minutes and shut the timer off. No, all night long, so that in case I do come out of my deep REM sleep, that rain sound helps lull me back into the REM mode where we have that good, deep, restorative sleep. So for sure, avoid silence while sleeping and even during the day, during quiet activities, trying to read or focus or concentrate. You can just have something low level in the background, whether it's instrumental music, a water feature, um, anything, a fan, like I said, or humidifier, anything that makes a low level sound. We're not trying to mask tinnitus ever, honestly. We prefer never to mask because what the brain cannot see, it will never learn to properly deal with, and it will never learn to rewire properly if all we're doing is putting a band aid over the sound. So avoid silence, but use low level, soothing, calming signals. And for sure, if you can, if you're not already, practice good self care. And what we mean by that is, take a walk, get some exercise, eat better, check your diet, drink more water, do some simple things like deep breathing. Are we getting enough oxygen when we're in a high stress situation? Like, really just flooding ourselves with oxygen can help decrease our perception of tinnitus. And things like meditation, mindfulness, all of those can help reduce stress and in turn help us calm down that tinnitus response. Um, so we hope that understanding some of these basics helps you realize that you're not alone. Tinnitus is not a disease, it's just a symptom of change. And the more we can help you understand that and feel confident that you know fully what's going on in your ears, in your body, in your brain, the better you're going to feel, the better you're going to do with trying to get your tinnitus under control. So we hope you'll continue to tune into the Sound Relief podcast. We're excited that in our next episode, we'll be interviewing one of our own audiologists, Dr. Megan Reed, who is really an expert at tinnitus as well. She has so many patients that she's been able to help change the quality of their life and really the trajectory of their life once tinnitus is under control. So we hope you'll continue to tune in. We hope you're gaining some good knowledge from listening. And one more thing, this podcast is presented for educational purposes only. It is not intended to be a substitute for medical advice from your physician. So thanks again for tuning in, and we hope you tune in next week. Thank you.